Hi, I'm Dr. Bevra Hahn, and I'm a professor of medicine in rheumatology at UCLA. And the purpose of this video segment is to introduce you to a person who has suffered from lupus nephritis for a long time so that you can understand what the experience of a person is like. So I'm pleased to introduce Liz Shaw-Stabler, who is an educator and has lupus nephritis. And Liz, I'd like you to take it away and give us a brief summary of what you've put up with lupus nephritis.
I suffered kidney failure in 1988, and I had to go on dialysis for 4 sessions. And after those 4 sessions, I was also treated with plasmapheresis and Cytoxan and large doses of prednisone. And so my kidneys kicked back in and lasted for another 22 years. But in 2006, my kidneys failed again. And so I had a transplant. My husband gave me one of his kidneys. And after that transplant, I was on a roll. And I continue to be on a roll, so much so that I now run a nonprofit organization. But I've had so many flares that sometimes if I'm not reading my book, I forget what they are, because I took a trip to Brazil in 2003 and came back and became ill, and the end results of that was that I had a blood clot on my lung. So I've experienced all kinds of symptoms with lupus over the 33 years that I've suffered with it.
And Liz, before you tell us a bit about your experience with treatments, I wanted to make a couple of physician-oriented comments about who you are and your lupus. So the fact that you're African American means you're predisposed to more severe lupus. You're more likely to get kidney disease, and it's more likely to develop into kidney failure than if you were a Caucasian white person with lupus. The same is true for Hispanic Americans in that they're more likely to get more severe disease, more kidney disease, and progressive kidney disease than are other races in the United States. So the fact you are who you are sets you up at the beginning for more severe disease. I heard you describe the fact that you got medical therapies and sometimes surgeries, and the result of this was a few years of better health, less active lupus, if I heard you correctly.
Yes.
So that indicates that we're far from perfect, but we do have some treatments for lupus that are effective. And you mentioned prednisone and Cytoxan, and I want to bring up the newer one, Cellcept, that's now used a lot for lupus nephritis. And I'd like you to tell people a bit about what it's like to be on prednisone and Cytoxan and immunosuppressives. What's it like from a patient perspective?
It's difficult to deal with the many medications that you have to take when you have kidney failure. When I had kidney failure in 1988, I was treated with Cytoxan. I was treated with high doses of prednisone. I had 4 sessions of dialysis, and I also had 3 sessions of plasmapheresis. And over a period of a very short period, my kidneys kicked back in. And so they lasted for another 22 years. In 2006, my kidneys failed again, and the result was a transplant.
So do you think the treatment and the side effects of treatment were worth it?
Oh, absolutely. Absolutely. Each time I made the comeback, it was wonderful. And with the kidney transplant, I've had almost 5 wonderful years of just going along and doing what I do best.
Tell us what it's like to live with a kidney transplant and take all the medications that are involved.
Well, it's wonderful to have the transplant because you begin to feel better all over. Your energy level skyrockets. The difficulty, I think, is trying to make sure that you get all of these immunosuppressant drugs taken when you're supposed to take them. I think I'm on perhaps 8 different medications, and I have a schedule, and so I have to be very cognizant of time because they're supposed to be taken at a certain time, and that's what I do. And that's perhaps why I've had 5 good years since my kidney transplant.
And tell me can you give me a look at what medicines you're on and what their purpose is?
Yes, the immunosuppressant drugs are Cellcept, Prograf, and prednisone. These drugs suppress the immune system, so they're very, very necessary. And they are taken 12 hours apart. So I have to be very careful when I'm out or when I'm partying or when I'm in church or wherever I am to watch the clock and make sure that I take them the same time each day.
For anything for blood pressure?
Yes, I am on a blood pressure medication, Norvasc. I'm on 10 milligrams a day, and that's very necessary because we must keep the blood pressure at bay because if it elevates, it can affect the transplanted kidney. So blood pressure is very important. I take my blood pressure almost every day, and I keep a running record of it so that I'm very aware of what it is when I see my doctor.
Liz, I want to thank you so much for taking this time to share your experience with us. Thank you.